Welcome back to AM Northwest. You don't have to let the effects of gravity determine how you feel about yourself. Here to share how you can look more like yourself, we welcome back from Aesthetic Medicine, Dr. Jerry Darm, along with his patient, Kelly Carpenter. Good to have you both here with us. So let me talk to you, Dr. Darm. What was it that you did with Kelly when she came in? What was she concerned about, and what were you concerned about?
She had some wrinkles in her neck, and also the jowls were starting to, take over, like you said, gravity. And so we did our MiniLift, which is a neck lift, and it's a little incision here. It goes right behind the cartilage for women and then back along the hairline, but it doesn't really show that much.
The before and after look great, and what is wonderful is that it looks very natural. So Kelly, what was it that then prompted you to see Dr. Darm?
I was very unhappy for a long time with just the aging process, and I felt too young to look how I was looking.
Yeah, you were feeling younger inside, right?
Absolutely,
yeah.
Absolutely.
And so you looked in the mirror and said, this has got to stop.
This is bothering me, and my husband knew it was bothering me, and he said, let's, try to do something about it. I shopped around for about a year, just seeing,
Right.
And about a year later, I came back and said, let's do it.
And then tell me about the process.
Well, first I sat with Dr. Darm, and he interviewed me, seeing what I needed, what I wanted, suggestions, never pushed me in a direction. I decided what I wanted, and I was comfortable. They were professional, and we said, let's
yeah, the pictures, before and after pictures. So when you look in the mirror now, how do you feel?
Oh, what a difference.
Yeah.
What a difference. I was constantly doing this. How do I hold this up? And just very self-conscious.
Yeah.
I'm like, how would I look? Is it worth it? It's a big decision to do
Scotch
that.
tape.
Scotch tape,
Oh,
yeah.
I've tried that. The duct tape. Would that work?
The duct tape.
You see on the infomercials.
You fix anything with duct tape.
Yes, absolutely. And why the MiniLift versus a full facelift, do you think?
Well, it really is kind of a full facelift, and in fact, it's different in that the dissection, most physicians just do an incision here and then pull, whereas the MiniLift we dissect down and free up all the tissues. That's why it looks so natural. That's the difference. It really does.
It doesn't look pulled. Doesn't look pulled at all.
No.
How long will this effect last?
It could last up to 20 years.
So just like the aging process.
Yeah, I mean, the tightness. I mean, there's still loosening with time, and the older you are, the looser you get. So there's a progression. And
what's the recovery time like?
About a week, generally speaking, for most of our patients. Could be less, could be a little bit more, just depending.
And do you keep low on activities, that kind of thing?
Yeah, you gotta really take it easy. You can drive in about 4 days, basically, but the first few days are really critical to just, lay low, take it easy.
And what have friends and family thought when they see you? Have they said anything?
Well, my family just found out today.
And so did everyone else.
Yes, my work now knows. I had one woman that hadn't seen me for a while, and she just looked at me and said, "Oh, you look great. You look wonderful," and had no idea why.
Yeah.
She said, "Oh, I can't put my finger on it." And then I told her. She said, "Oh my goodness, I would have never known."
Most people think you just look well rested, and
exactly, just brighter eyes and just not,
Yeah.
just droopy.
So you just feel better overall?
I feel better, and that was the biggest thing that motivated me.
That's fantastic.
To feel better. Inside, you feel better outside.
There you go. Couldn't have said it any better. All right, let's. If folks would like to find out more about aesthetic medicine, you can contact them at 503-697-9777. Thanks so much, Dr.